Hi, this is Randy Wykoff, the Dean of the College of Public Health at East Tennessee State University, and I'm pleased to provide this week's update on the COVID-19 pandemic for the week ending Thursday, February 25th, 2021. As with all weeks, I will answer the first question, which is, how is the pandemic progressing globally in the U.S. and in our region? And then two questions that have come up this week are we approaching herd immunity, which I've addressed before, but it's obviously an important question. And if we are masks still important? In terms of the pandemic, we have just passed 2.5 million known deaths worldwide and over 100 million cases. 2.5% increase in the past week, which is actually quite good. Because if you look at the percent week-to-week increase, you can see that 2.5 is actually the lowest we've had actually in recent recorded history, very close to where we were in early September. So the week-to-week growth rate is good, but I wouldn't put too much emphasis on it right now. As you can see, globally, the number of deaths has started to come down after a pretty significant rise over the last couple of months. In terms of the United States, we have passed 500,000 deaths, the third leading cause of death in our country, 16,000 deaths last week, more than 2,000 deaths a day, and a 3.2% week-to-week increase. So a slightly greater increase in the U.S. and in the rest of the world, but certainly it's come down quite a bit. And as you can see, 3.2% is in the range of what we were seeing in September, August through September. So again, it's reassuring to see those rates coming down. And again, even though there's been some up and down, you can see that over the last month or so, the number of daily deaths has gone down. In terms of where cases have been, this will take us from August through February, August 14th, August, September, October, November, December, January, February 14th up to February 25th today. And you can see that there have been cases all over, but certainly the most in our region, sort of the central south, and then this region east of the Rocky Mountains. In terms of where cases have been in the last 2 weeks, this really tells you the story of the exploding pandemic in our country. August, September, October, November, exploding in December, January, February. So again, this sort of think of it like a wildfire. It just starts and it burns wildly. Hopefully we're getting past it. If you look at our region, again, for the first time in a while, we're not one of the worst parts of the country. If you look at the state statistics for our region, the number of deaths is quite different. Deaths per million in Tennessee and South Carolina are about 50% higher than the other three states. And week-to-week change, not pretty similar to the U.S. with the exception of Virginia. And as we've said before, any 1 week-to-week change could be due to reporting issues. We'll keep an eye on this for next week. In terms of the ballot health 21 county area, 1,816 deaths. And you can see that sort of inflection point. About 3 weeks ago, seemed like things started to slow down a little bit. 3.1% increase in the past week, a little bit less in the U.S. overall. So globally in the U.S. and in our region, the pandemic currently appears to be slowing down. So one of the questions that gets asked is, are we approaching herd immunity? This idea of herd immunity is that there is some percent of people that are immune that are sufficient to stop the spread of the disease. So if you think of any population having three types of people in it, those that are not immune, here shown in blue, those that have been immunized, got the shot, shown in orange, or those who have been infected and are now immune, shown in gray. And to get herd immunity, we're going to need to get that non-immune group down to somewhere between 10 and 30%. We don't know precisely. You'll hear that 70% up to 90%. So somewhere in between 10 and 30% of the population has to be immune in order to get herd immunity. Well, where are we now in Tennessee? According to the Tennessee Department of Health, 1.2 million vaccinations have been given. And these are the numbers that have received 1 or 2 doses. So 11.2% of the population have received at least 1 dose. The other part of herd immunity is, of course, cases. 768 11,000 cases have been reported, 11,000 deaths, leading about 750,000 people. Interestingly, almost exactly the same number that have been immunized. So if you take those three numbers, it looks like that. The vast majority of people in Tennessee are not known to have been infected. On a percentage basis, it's 12%, 11%, and 77%. But what we know from the CDC is that for every known infection, there may be as many as 4.5 unrecognized infections. If that's true, then about half of the population may have been infected already. And if you add that to the 12% that's then immunized, you're up to 63%. Still not 70 to 90%, but getting somewhere close. There's another website that suggests that 37.3% model suggests this of Tennesseans have been infected, in which case we're about 50% of the state is probably immune. So we're not at 70 to 90%, but we're getting there. There are some caveats with this, all right? We don't know for sure how many people have had undiagnosed disease. Not everyone who has the disease or the vaccine is immune. We think it's somewhere between 95 and 98%. But importantly, immunity may lessen over time. It may not be completely protective. In other words, someone may have been infected. We know there have been cases of second infections, so it may not be completely protected. And we're not sure. I said it may be possible for someone who is immune to still spread the virus, that it may be that I'm protected from getting sick, but I can still expose other people. But perhaps the single most important question, the unanswered question, is we don't know if this immunity will protect us against mutated versions of the virus. So we have to keep going to protect people through immunizations and other actions. And that leads to the third question, are masks still important? People say, well, come on, if everything's going down, let's lighten up a little bit. I say just the opposite. This is global deaths, okay? And you see, and I've been pointed out that it's coming down. That's great, except the daily deaths are still way up higher than they were even back in March and April when this pandemic really started spreading. Even in the US, we can see that we're pretty much back to where we were in March and April, but nowhere close to where we were in July through October. But perhaps more importantly, you can look and you can see there have been several times when we've seen a decrease in the number of deaths. All right. So we're not out of this yet. And what really worries me is what we've seen in Europe. If you look at the four most impacted countries in Europe, you can see that they had this spike in deaths in March and April, and then very, very few cases over the summer, and then a second spike. What we don't know yet is this the pattern that we're going to see in the US or not? So the bottom line is, while we can be optimistic, we're glad to see the number of deaths going down, we simply don't know what's going to happen. And so we have to continue wearing masks, social distance, avoiding crowds, and taking the other actions we know can work. This is not the time to let up, because if we're facing a second spike or a mutated strain, we need to get ahead of it before it happens. So the questions this week: how is the pandemic progressing? It seems to be slowing down. Are we approaching herd immunity? We're getting there. We're not quite sure how close we are. And are masks still important? Yes, they are. A great deal more information about COVID-19 on the College of Public Health website. If you'd like to be added to the mailing list and know anyone who would, please contact Jan Stork at storkj@etsu.edu. As always, I'd like to thank Melissa White for helping to collate data and Dara Young for editing, producing, and posting this video. And as always, these videos are based on the questions that I get from you. If there's any issues you have questions on, please let me know. I'd look forward to trying to answer them. Please be healthy.